Hello and welcome to the Headache Doctor podcast. I'm Dr. Taves, and it's my mission to empower everyone with headaches and migraines to break free from a life of fear and dependence and thrive in everything you do. Thanks for tuning in to today's podcast. Today we're going to talk about Botox and any potential surgeries that you could have or maybe recommended to you if you have headaches or migraines. We're going to talk about what happens when you receive Botox. Is it effective? Is it something that you should consider? And how, from a neck mobility issue, as this being a neck problem, what does it mean to get Botox? Is that helpful? Does it kind of add to the type of care I provide? Or does it take away from it? Is it even needed in this whole process? And then if there's any potential surgeries, we'll talk about a few options, and surgery is really not that common with patients that have headaches and migraines, but in the extremes of things it can be done, and so we'll talk about that and kind of the approach that surgery may take. So first off, let's talk about Botox. Botox is very, very common. It's one of the more prevalent interventions that the medical doctor, the neurologist, really will provide to patients with headaches and migraines. And it actually can be very effective. The type of experience that patients have when they go through Botox can be a very positive one. And oftentimes it's more helpful than the medication route. It's more helpful than the preventative or the abortive meds that a lot of patients have tried, leading up to the point of saying, okay, now we need to go down the road of Botox. Now, the reason people are hesitant to go down the road of getting Botox is because it can be uncomfortable. So there's 30 plus needles that or sites that Botox can be injected, and then there can even be more than that. So there's a lot of this sort of like discomfort having a needle in all these different areas that some patients are fearful of. The other thing is it's expensive, and oftentimes insurance doesn't cover it. So it can be $1,500 to go through one set of injections for Botox, and the Botox itself is costly. The visit to the neurologist is costly. And then probably the biggest reason, at least from the patients I talk to, why they wouldn't go through Botox is because they realize that as it will calm the pain down or calm their symptoms down, they may need to just return to it every 3 months. And do they want to go down that road of being dependent on the Botox? And for some people, they choose not to because they don't want that dependency on Botox, just as they would another medication. That's the same sort of reasoning that a lot of people use when they don't want to take the prescription medications. They believe that it is masking the symptoms and that it's not treating the underlying cause. And so why go through the process in the first place to just sort of cover up what your body's experiencing? Why don't we pay attention to what the body's telling us and figure out what's truly needed? Botox is a little bit closer, gets a little bit closer to actually solving a problem. So with a lot of the medications, especially the pain medications or anti-seizure meds, what they're doing, or the CGRP drug, what they're doing is actually sort of shutting off the pain pathway, or maybe it's increasing serotonin. It's sort of manipulating at the chemical level how our body's functioning. And really what that means is our body has a cascade of events in response to inflammation from our neck that ultimately leads to us experiencing head or facial pain. And these pharmaceutical drugs are changing that cascade of events. They're sort of manipulating it so that we don't experience symptoms that are as severe as we would normally. And so when we look at Botox, it is a local intervention. So that's a good thing. When we ingest something, it is more of a systemic process. So it needs to be filtered through our liver, and our body needs to break it down and then disperse it and then use it appropriately. But it's not like these medications are localized. That's why we have side effects to medications, because oftentimes it's affecting other systems in a negative way. But if we have a net positive, so if it reduces your pain enough, then we're okay with whatever side effect there may be. Or a lot of patients have severe side effects, so it doesn't necessarily outweigh the net gain, or if there may not be a net gain in the reduction of their pain when it comes to the headache or migraine. And so Botox is local. It's injected into the neck, into the forehead, into the temples, into the scalp, and it is local, and that's a good thing. But Botox is botulinum toxin. It's an actual toxin. It's something that, technically you could call it like a poison. And believe it or not, a lot of medications are kind of, they fall into that category. And so what the medical field has done is just manipulated sort of the dosage so that, again, they manipulate a certain aspect of the body's function without the negative side effects as much as possible. And so Botox is kind of that same thing. If we inject it locally, it'll have a local effect. And that local effect is really on the muscles themselves. So it'll actually paralyze the muscle tissue from being able to contract. And Botox can be used as sort of a diagnostic. And so when patients come to me and they've either had Botox or are thinking about Botox, well, if they've had Botox and it helped, but it helped temporarily, then that's actually a good sign that the patient is responding to an increased amount of muscle tension running through their head and their neck. The fact that Botox works actually gets a lot of neurologists to acknowledge that the neck can be a problem. And so the amount of tension running through the neck in a lot of headache and migraine patients is something that neurologists are aware of, and ultimately because when they're prescribing Botox and administering it, that is ultimately what they're changing. It's taking these muscles that have been tight and restricted for so long, and they're actually causing pain. They're part of that pain signal, and calming those down. And now it's an artificial way of calming those down. It's basically just like it's injecting a toxin that is just going to, like I said, artificially cause that muscle to relax. So it's forcing the body to do something that it naturally wouldn't do. So the problem is technically still there, but as long as the Botox is intervening and shutting off that muscle from contracting, then the result is that you'll likely feel better. So one, I use it as a diagnostic to say, okay, if you went through a series of Botox injections and it helped, that's a good sign that your neck is driving this, and that there's muscles in your neck or in your head or your face that are irritated enough that they're causing a pain signal. And so that's number one. It kind of gives me sort of support for this being a neck problem. Moving forward though, so if someone comes to me and they're thinking about Botox but they haven't had it yet, usually I am kind of hesitant to allow them to go down that road. I mean, the patient can do whatever they want, but if we are treating the neck problem, it kind of gets confusing for the patient. I can feel progress on their neck, but oftentimes I'll use the patient's symptoms to tell me how much progress that they're truly making. So it would be like me working on the mobility of their neck and seeing 20%, 30%, 40%, 50% progress. But since we've used Botox to intervene, we've sort of masked what the body's feeling. And with a lot of chronic pain, it's very, very important to understand what the brain is actually realizing as pain. So our pain is, I want to get that feedback from the patient. I want to get that feedback from their body. And if we sort of shut that off, it really does complicate things, and it makes it confusing for the patient and for me, frankly, to understand how effective the treatment truly is, and the treatment being me working on them. So it is kind of acting as like a Band-Aid that confuses any progress that we might be having. So I usually don't recommend it while I'm going through treatment with a patient. Some patients might think, or some people might argue that if we reduce the amount of muscle tension, then it'll be easier to work on the joints in the neck, which are That's where we've lost mobility. That's what's kind of driving this problem, is the lack of movement through the joints. And so, yeah, maybe if I really get into a bind and a patient can't relax, if their muscle tone or tension, just the amount of a contraction through that muscle won't relax, then maybe Botox would make sense. But if we jump to the Botox as an intervention while I'm treating someone and we have it and we're making progress, and I know that their neck is likely going to be the solution if we get it moving, then it really is more of a confusing thing than a helpful thing. So Botox is local. It paralyzes the muscles in an artificial way, so it's not necessarily a good depiction. It's not fixing the underlying problem. Now, the reason the muscles are tight, and this is where the neurologists, most of them will kind of stop here. They'll say, like, this is a muscle tension problem, like, let's do Botox to help reduce the severity of your symptoms. But the next sort of steps in that line of thinking are to say that to ask the question, why are those muscles tight? Why are those muscles angry? Because if they're responding to Botox, that just assumes they are. And so to answer that question, we have to understand how the joints themselves move. So this is me being a broken record, but the joints, the joints that those muscles are acting on to move are tight and restricted. And this is true for most things in the body. The joint that the muscles are trying to move is usually the problem. It'll be restricted. There's a joint capsule that'll kind of have adapted to a shortened position. Maybe there was some trauma that led to scar tissue and the joint doesn't move as well as it should. And the muscle's still kind of programmed, for lack of a better term, to have a certain degree of mobility, to be able to contract and then relax. And if it can't contract and pull the joint as far as it can, over time it'll get stressed out and irritated. So the Botox will help relax the muscle, but it will not fix the joint mobility problem. And so to truly fix the underlying problem, so that you don't have to rely on Botox injections over and over and over again, we have to address the joint mobility, and hopefully we address the joint mobility first. If you have gone through this series of Botox and you're thinking, okay, I've got another 6 weeks till my next injection, what I would encourage you to do, even if Botox has worked, is find a good physical therapist that can work on the upper part of your neck and restore mobility to those joints, because my suggestion or my hope would be that you can actually get out of that cycle of having to go back to Botox over and over and over, because just about everyone doesn't want to be reliant on that form of treatment. Again, because of the cost, the discomfort, and oftentimes, I didn't mention this earlier, but I've had several patients that just have bad reactions to it. Sometimes that means they get a worse headache right after, and it actually can sort of stir things up. Oftentimes just really sore. Patients will just feel out of it for a couple days. And so it's a lot to consider for patients to keep doing something like that. And so if we can address the underlying problem, so if we can address the underlying problem, that's always a better avenue. So in general, Botox is going to be oftentimes a better solution than medication, more effective. It's local, so you don't have a lot of these systemic side effects that could come from just ingesting a medication, one of the preventatives or abortives. And so it's not a bad option, but again, you have to understand that it is artificially reducing the amount of muscle tension, and we kind of want to use what the patient feels to our advantage. But the problem is where these patients aren't being seen by the right providers. So the assumption here is that the right treatment is on board. So if you have the right treatment on board, then Botox is really just a distraction, a confusion. And so we want to hold off on Botox until we've really treated the neck properly, and then we can trial Botox if for some reason we hit a roadblock. Or if, because there's a small percentage of patients that working on their neck is not all they need, and so we need to add something like Botox in. And Botox can actually be targeted, so if there's certain areas in the neck, you can ask your physical therapist, like, what should my neurologist focus on, or where should they try to target the injection? And so you can kind of use the physical therapist who's going to be more versed in the anatomy with the neurologist who is just they're the one administering the Botox. So those are my thoughts on Botox. I know a lot of people have either considered Botox or gone through it, so hopefully that's helpful. Let's talk about a type of surgery that I've heard several patients talk about and several others mention as a potential option. So there's a nerve ablation, there's sort of a decompression type surgery, and all of those two are sort of focused on one. A nerve ablation is sort of like, I think they have different methods of doing it, but think of it as like just removing the sensory nerve. So if a sensory nerve is really angry and it just seems to be like your pain is all concentrated, it's from like the occipital nerve, they can do an occipital nerve block or a nerve ablation where they're actually just sort of shutting off that pain signal to be, they're cutting off any sensory input from that nerve. And this can be effective. Usually what happens though, because our peripheral nervous system it has what's called plasticity, so it will adapt and change, and it'll actually regrow. So it'll regrow a pathway, and usually over a period of time that the pain will just return. And sometimes it's even like a stronger pain signal because, a couple of theories here, but one is, if you remove the pain is there telling your body like what to avoid. So oftentimes, like, if you roll your ankle, you're limping because you want to take stress off your ankle. Well, if you roll your ankle and you have no pain, you just walk normally, then your ankle is just going to get more and more irritated. If your neck is injured and you do a nerve ablation to take away the pain, you're likely to just play into the problem that was there in the first place, and you're not going to avoid the certain movements or be as hesitant with neck movements as maybe you would normally, and that can actually be detrimental to the health of your neck. And so when the sensory input actually returns, you're worse off than you were in the first place. So nerve ablation, occipital nerve block, things like that are really just a way to locally affect that specific nerve. And then we have nerve decompression. So sometimes a nerve will actually have like pressure, inflammation, like tension around it. And so they can go in and sort of carve out some space for the nerve itself. This can also be helpful just because if the nerve is truly irritated, then clearing up space for it is going to allow it to breathe. And so if that's part of the problem, that can actually be a viable solution. But again, we have to understand why that tension is there in the first place. Why is the muscle or the tissues surrounding the nerve, why are they sort of occluding the space? Why are they causing that nerve to require a decompression? And that tension, if we go back to what I said earlier, it really follows or stems from a dysfunctional pattern, which is usually the joint not moving the way it should, and the body moving in a different pattern than what it's used to. And that increases the amount of stress because that movement is usually not as efficient. It's not how the body was intended to move. And so we've got smaller muscles doing more work. We've got the neck in general and just like every muscle that is holding our head up having to do more work. We've got deeper postural muscles that are becoming weak. And so this whole system of like saying, okay, we have tension around this nerve that's really like a myopic, a very focused evaluation of a bigger problem. So you're kind of like zooming in on the tree, but you're missing the forest. And again, they're interventions that are there and can be helpful, and they do help a lot of patients. But the problem with our system right now is we are doing these interventions for the dead trees in the forest, but we're not understanding the bigger picture. We're not looking at the forest as a whole. We're not understanding where the tension's coming from. We're just treating it with the Botox or the nerve ablation or the decompression, whatever it is. And these are all things that, the surgical procedures can be more permanent in that they're changing tissue permanently, but the underlying problem is still there. I had a patient earlier today where I was explaining why surgery oftentimes is still not correcting the underlying problem. And I used the example of having a car that was in an accident and the frame's kind of bent a little bit. And so when you drive down the road, the alignment's off, and maybe it drives okay, but the tires wear a lot quicker. And so you get to a point where the tires are really worn. And like let's say in a patient example, like this is you the patient. So you're a car that has the frame a little bit off and your alignment's off and your tires are worn. Well, the surgical approach would be like looking at the tires and saying, well, clearly your tires are worn, we have to replace those. But what I'm trying to tell people is, no, your frame is bent. We need to correct the frame so that you're driving down the road properly, and there's not increased stress through the tires in the first place. Because if we just keep replacing tires, the problem's just going to come back over and over and over again. And so we need to kind of zoom out and understand the bigger picture. And then we can use these interventions to help us if we have the bigger picture in mind. But we oftentimes don't. And these are the only things that we're provided with without having sort of the understanding of what's going on to cause this in the first place. And so let's kind of back up and understand what is causing it in the first place. And I think headaches and migraines will be a much easier problem to fix. And it will not be as debilitating, and it will not be this sort of epidemic that it's affecting so many people. So anyways, that's today's discussion on Botox and other interventions aside from medication, and what my thoughts are about that. Again, to summarize, let's look at the big picture and understand that before we jump into this stuff. This is the Headache Doctor podcast, and I'm Dr. Taves. And again, it's my mission to empower everyone with headaches and migraines to break free from a life of fear and dependence and thrive in everything you do. Thanks for listening.